I'm out here at one of Vancouver's favorite urban green spaces, Stanley Park. Now, we've heard it time and time again that it's good for your health to spend time in nature. But could you actually imagine your doctor prescribing you a walk in the park?
I think it's kind of a missing piece. I think we should really see nature as the fourth pillar of health.
Dr. Melissa Lem and the BC Parks Foundation just launched PARX, or P-A-R-X, like the shorthand for prescription. Dr. Lem says it's Canada's first national evidenced nature prescription program.
So we are welcoming healthcare professionals, anyone from doctors to nurses to physiotherapists to psychologists, to register with our program and receive their own unique prescription file to start prescribing nature to patients for the health benefits and also to improve their own health.
The Nature Prescription Program recommends people spend at least 2 hours in nature per week and for at least 20 minutes each outing. Dr. Lem says these recommendations were based on studies that found people who spent a minimum of 2 hours outside in nature per week reported significantly better health than those who didn't.
A couple years ago, there was a fairly major meta-analysis published that looked at a number of different diseases like hypertension, like cardiovascular disease, preterm births, mental health outcomes, and they analyzed all this and linked it to the amount of nature time and green space that people were exposed to or spent time in. And what it found was that this spending time in nature significantly reduced their risks of a lot of these different diseases.
Andy Day with the BC Parks Foundation says there is a benefit not just for individuals, but for the economy too.
The better people feel, the clearer they feel, the more creative they feel, the more economic juice we're going to have. By helping slow down and reduce the rate of the number of people who are suffering from different illnesses, we're saving money on the budget side, and we're increasing productivity and boosting our economy.
In the United Kingdom, it's estimated the National Health Services could save over 3.4 million Canadian dollars in treatment costs if everyone in England had equal access to good quality green space. As for the newest Canadian Nature Prescription Program, Dr. Lem says it's now getting shared with different healthcare networks.
And so we'll basically ask healthcare professionals to recognize patients who could use it and print out the prescription, a customized prescription, and hand it to them along with a customized fact sheet. And then the patient will register their prescription on our website to show the prescriber that they filled it, and then be registered in our program and continue to stay in the loop about the health benefits of nature.
Well, armed with this information, you could head to one of the Lower Mainland's many parks, just like this one, ahead of a prescription. In Vancouver, Kier Junos, City News.